Hi, this is Shanna at CoroWare. As you know, one of the things that we provide is video conferencing service. It's what I use to do these video blogs. And we have a number of healthcare providers that are using our service. They're primarily using it for mental health consultations. But this is becoming more and more part of the mainstream, particularly when you consider that a fairly famous television personality has just announced that he is participating in an offering like this. Yesterday on Bloomberg Business Week, Dr. Phil has announced that he is participating in Doctors on Demand, which is a service to increase online access to doctors. In this particular service, the doctors will connect through a mobile device to the patient and do a consult for things like the cold, maybe a urinary tract infection, things that don't necessarily require that you be physically present. Most of our customers that are using our service are doing mental health consults. Well, this takes it a step further. An awful lot of the visits to urgent care and to the ER are for things that the doctor can diagnose over a phone or preferably through a video conference. And this allows us to decrease the amount of waiting that's going on in an ER, in the doctor's waiting room, and allow the doctors to sort of optimize their time. They don't have to spend as long with you. You don't have to wait as long. I think it'll be interesting to see how they figure out how to handle all of the paperwork for it. But it's a growing trend. This expands the capability and access to doctors in remote locations, in places that don't have as many doctors as other places. The amount of doctors per person differs widely across the U.S., and it's a model that has already started to take off in other countries. I think it's interesting to see how mainstream using video conferencing and how mainstream telehealth is becoming. I think it's a great trend. I think a lot of us don't really know how to optimize our health, and I don't think doctors provide health care. I think they provide care when we're having problems. This will allow them to do that a lot more efficiently. If we're going for health care, we would be doing a lot more of the preventative stuff that is hard work, and therefore we don't want to do it because it's not just a pill. Obviously, that's just my opinion. What do you think? Is telehealth the way to go? Is it going to provide more access to the kind of healthcare that we need? Let us know in the comments, and thanks for listening.